I've been in 42 countries about the world, and I have had discussions with numerous individuals who are involved in the alien abduction phenomena. I've come to believe that approximately 15% of these individuals may have an object within their body as the result of the alien abduction phenomena. We look at both the metallurgical and the biological findings. We find some very astounding things. We find that the metal objects are covered with a very strange soft tissue membrane, which is actually attached into the metal, and that goes far beyond our scientific abilities. We find also that in the surrounding tissue, there are large amounts of nerve cells which are not correct for the particular area. These are called nerve proprioceptors, and perhaps they are responsible for giving the energy supply so that this becomes a functional object. When we look at the metallurgical findings, we find that there are several unusual things. For example, the objects being metal and highly magnetic contain large amounts of iron, but yet the iron is amorphous iron. It's without crystalline form. Now, I was able to find through black budget laboratories that we do know how to make amorphous metals, but we don't know how to make them magnetic, so that's quite an anomaly. And then the next most telling metallurgical finding is that when we look at the isotopic ratios of some of the metals within the objects, we find that they are non-terrestrial isotopic ratios. So, to sum up, we see individuals who allege alien abduction. They find an object within their body which is verified by an X-ray, a CAT scan, or an MRI. They have some distress from the object. They want them removed. We accept them as a candidate. The object is removed, submitted for scientific analysis, and then we find things like non-terrestrial isotopic ratios. Then what is a logical person going to conclude, other than the fact they are telling you the truth? One of the most unusual objects that I've come across recently is an object that was in the arm of an abductee, and this object moved underneath the skin. When you touched it with your finger, it would move out of the way. And after putting your finger on the area for a while, it began to come to your finger. It would go in the opposite direction. You could move your finger someplace and the object would actually come towards it. Very, very strange, hair-raising, skin-crawling thing to witness, even for me being in the medical field for over 41 years.